The OECS Regional Coordinating Mechanism, the RCM, for HIV/AIDS has been awarded a grant from the Global Fund of $5.3 million in the fight against HIV and AIDS. Various ministries and organizations from across the OECS have been working and strategizing for months to secure this funding. Director of the OECS RCM, Joan Didier, says the injection of funds comes at a pivotal time for the sub-region.
We are very elated about this. The OECS Commission, through the OECS HIV and AIDS Program Unit, has been doing work in HIV in the OECS since 2005. They are currently working through a grant from PANCAP, and that grant comes to an end in December of 2015. So the OECS RCM is particularly elated because it means that come 2016, we will have money for another 3 years work in the OECS.
The OECS Commission will be the implementing agency as the principal recipient of the funds.
So they will work through the ministries of health in the 6 OECS countries. The ministries of health will be the sub-recipients for the grant. And the Ministry of Health will then work with civil society organizations, particularly organizations that work with men having sex with men, commercial sex workers, transgenders, and young people, to ensure that these populations who sometimes are restricted in their attempt to access services can have freer access to service.
Another anticipated achievement for the OECS in its HIV and AIDS battle is validation from the Pan American Health Organization and World Health Organization on the elimination of mother-to-child transmission. While this remains just a formality, Ms. Didier says the real challenge lies in maintaining that record.
The elimination is one thing, but the continued zero status must be facilitated, and so those funds will help us to build on that, to ensure that we can bring more people into care. The idea is to bring as many people into treatment and care as possible, so we can work towards having zero AIDS in 2020. The OECS is working towards elimination of AIDS in 2020. Now, I know that sounds almost impossible, but I didn't say HIV, I said AIDS. AIDS is advanced HIV disease. If we can ensure that anybody who is HIV infected can get into care, we can achieve that.
Meantime, Health Minister Alvina Reynolds, who is also the chair of the OECS Regional Coordinating Mechanism, says the multi-million-dollar grant will be used to target the vulnerable groups in the society.
We know that people are vulnerable across the board, but there are certain populations, for whatever reason, they may not want to come forward. They may feel that they're discriminated against, and this is what we want to focus on. Our target populations that we need to reach, because we fear that if we don't, there will be serious consequences in that regard. And so this is what we're looking at. We have been very strategic in how the funds will be used among our St. Lucian population, the men who have sex with men, our young people, our commercial sex workers across the island. Of course, the issue of stigma and discrimination that really pushes people to the background, that they do not want to come forward, they don't want to come for testing, and even for treatment, because of fear of stigma and discrimination. Of course, fear of judgment of whatever they engage in, the behaviors that people are judging them. So we must reach our people wherever they are and provide that level of support, provide testing, provide treatment and care that we see to prevent infections. But more than that, persons who are infected, that they continue to live a meaningful life and make their contribution to society.